Good morning. Today we'll be talking about sarcomas, and it's a condition that we will be learning a lot more about because it is unfortunately a lot more common than a lot of people might think. Good morning, Dr. Akinmokun and Dr. Alabi. Thank you very much for coming on the program.
Good morning, Dr. Pamela. Good morning, Dr. Alabi. Thank you.
Good morning,
Thank you for
everyone.
having me.
Good morning.
Thanks for having me too.
Now,
It's a pleasure to be here once again.
it's a pleasure, always a pleasure to have you on the program. If I can start off with Dr. Akinmokun. Dr. Akinmokun, you're a surgeon, you're, an orthopedic surgeon, you see a lot of sarcomas. So can you just start off with just telling us what are sarcomas? Where do they appear in the body? And why do we need to know about them?
Thank you very much for the question. Sarcomas are their malignancy, or if I want to make it a bit more simpler so that we use big terminologies for people, these are cancer cells that do appear in different areas of the body. And almost all tissue in the body can eventually turn cancerous. And when they turn cancerous, then we can call them sarcoma. There are different types of cancers in the body, but the ones that affect the soft tissue, the flesh more, is what we term sarcoma. And there are different types of them. They can appear in any tissue in the body. They can affect the flesh. They can affect the bone. They can affect the cartilages. They can affect the blood vessels. They are just they can affect any of the organ in the body.
And what are the common ones you experience in your own practice?
Yes, so if we talk about the common ones that we do experience in the practice, being an orthopedic surgeon, we tend to see the osteosarcomas more. That is the sarcoma that affects the bone. Then we tend to also see the rhabdomyosarcoma. That is the one that affects the skeletal muscles. Skeletal muscles are the muscles that we see that we call flesh generally. Then we have sarcomas also that can affect what we call the smooth muscle. The smooth muscles are the muscles like the ones in the bladder. We call them leiomyosarcomas. Then we have the sarcomas that can affect the blood vessels that we call angiosarcomas. So then also there is a sarcoma that we get to see in younger people called Ewing sarcoma. That tend to affect the bone also, and then the flesh. And so there are different types of them, and they have different names that we call them, and they can occur in any tissue really in the body.
And do they occur at any age, or is there any specific age that people should be watching out for these type of sarcoma?
Yes, some of them are seen in younger age group, some are seen in older age group. So it depends on the type of sarcoma. For instance, the Ewing sarcoma that we talked about, it's seen more in younger age group and adolescents. The osteosarcoma actually has two age group that we get to see them. We see them in younger age group and adolescents, and also we see them in elderly people. And so it depends on the type of sarcoma, and then they can occur at different ages. But the only thing is for the doctor to get to have this high index of suspicion. When someone comes to you, don't just overlook. You must examine your patient properly, and you must have at the back of your mind that it could be a sarcoma when you see people presenting with symptoms that look like sarcomas.
Thank you very much. So, Dr. Alabi, patients will go to our doctors, I'll go to our surgeons, and they'll have the sarcomas removed, and they will come over to you. And you are the one who is the oncologist who tends to see some of these subspecialized, so these particular ones that come from different specialties. So Dr. Akinmokun has already spoken about the osteosarcoma. Is this one of the ones that you'd like us to dive into? Because we can't do all the sarcomas, obviously, on this program, but we could just take one or two. And we talk about the osteosarcoma. Can you tell us from your perspective why people need to know about it? And from my perspective, I want to know, is there anything that people can do to prevent themselves from getting it?
Okay. Thank you for the question. So just like Dr. Akinmokun said, we have quite a number of sarcomas. There are up to like 70 different types. So, but in my specialty. We see quite a lot of osteosarcomas, and we see the young adults, children, elderly. And so it's not really particular about age this time around. We don't see so much of Ewing sarcoma here in Nigeria, but we have quite a lot of osteosarcomas. And to talk about the question of what should people watch out for, I think one of the reasons why people don't know that some cancers also is because sarcomas generally are rare. They are rarer than breast cancer, cervical cancer, prostate cancer, and so we don't talk so much about it. So, but when we do have opportunities like this to talk about it, we want to tell our people that when they see a swelling in any part of their body, or they have pain in the bone, which is just not going away, it may be a cause for concern and something they should they should get to the hospital to have it evaluated, especially when they have a swelling which is not painful and is just growing and growing and getting bigger. So they think that, oh, probably it's normal to have that. So because when it actually becomes painful, that is when it is becoming a bit of an advanced stage. And so most oftentimes it's not painful, and because of that, they do nothing about it. Generally, we talk about cancers, we say we don't know what the cause is. For example, when we talk about lung cancer, we see that it's associated with people who smoke a lot. So smoking is a risk factor for lung cancer, just like sunlight, too much exposure to sunlight for people who are light skinned. Okay, sunlight becomes a risk factor for them having skin cancer. So likewise, when we talk about osteosarcomas or sarcomas generally, we also say we don't really know what causes it, but we've been able to associate some things as risk factors to such cancers. Such things like exposures to chemicals, people who work in chemical industries, vinyl chloride especially, and have to deal with a lot of chemicals. Some people who have genetic predisposition. For example, people who have a family history of one type of cancer or the other. Childhood cancers like retinoblastomas and some other cancers can actually be at a risk of having osteosarcomas or any of the sarcomas. Another risk factor that is prevalent with this type of cancer is exposure to previous radiation. So people who have had exposure to high dose of radiation before can also be at risk of this cancer. People who have risk of what we call lymphedema, that's swollen legs or swollen hands, prolonged period of swollen legs or swollen hands can be at risk of having sarcoma. So when we look at all these factors, we can't really pinpoint and say this is the one that is causing it, but we just see that there are some stories behind it that always look similar to each of these cancers occurring in that individual.
Well, I think thank you for that. I think that's been a very well-rounded discussion about some of these things. But I think what is important that I'd like to take out of it, I think people should listen to, is the fact is that when they see anything swelling or growing anywhere, don't ignore it, even if it's not painful. Have it checked out. Am I correct?
Exactly. Just to buttress that, many of the children who come down with osteosarcoma, their first presentation is usually a fracture. Oh, they went to play ball and then he fell down. Oh, he's a very naughty boy. He doesn't listen to mommy. He doesn't listen to daddy. And then he fell down and broke his leg. And then, so it didn't start in a day. It most often doesn't start in a day. The child must have had some complaints about the leg or the arm, okay, because osteosarcomas are common in the extremities, the legs, the limbs, whether the hand, or the legs. So it's common in the extremities. And so the child must have had some symptoms which the parents probably didn't pay attention to. And then because the bone is now weak, so he played and fell and then broke it. And then that is when they will force to know that anything happened. So it's always good we know ourselves. We know how our body is. We know, oh, my hand was never as big as this before. I didn't have this swelling before. Now that I'm having it, could it be a pointer to something is going wrong? And so we need to know ourselves so that we can quickly know when something is wrong. Yes.
Thank you. I think that that's so important, particularly this issue with children, because a lot of people think children don't get cancer. So how do you explain that to parents?
Well, so just to tie it again to the risk factors, so everybody can have, anybody, whether male, adult, elderly, as old as 90 years, can have cancers. Children can have cancers as young as 6 months, okay, can come down with retinal cancer of the eye. So every part of the body can have one type of cancer or the other. The only places where we don't see cancers occur are maybe our hair, the teeth, our nails, more of dead tissues in the body. You will not see cancer occurring there. And so because of that, so everybody is prone to having cancer. And because we know that, we want everybody to be vigilant about themselves, to take their health important. Many of these cancers, if found early, are curable, especially for the children. When found early, they are curable, but most times because we don't pick it early, because we don't present early, and that's where the problems usually come from. So parents should be aware that children can have cancer. When they see anything wrong, they should not hesitate to get to the hospital to have it checked.
Thank you. Thank you very much. Dr. Akinmokun, can we just start off with you again and ask you, how do you make a diagnosis of sarcoma? And then maybe from there, we can start talking about how do you treat?
Thank you very much. So the first thing we ask patients to do, especially when they come to us, if we are going to treat osteosarcoma, is for them to do an X-ray. And then also we ask them to do what we call magnetic resonance imaging, MRI, because the X-ray of osteosarcoma is actually classical. By the time we look at it, we can say, oh, this looks like an osteosarcoma. And then by the time we do the magnetic resonance imaging, it shows the image of the body very well in such a way that we'll be able to say, now, this is what we are thinking about. And then we must do what we call a biopsy. Now, biopsy is when we take a part of the tissue that we think is cancerous and we send it to the lab for the people in the lab to look under the microscope and confirm to us. That helps us to, number one, make the diagnosis proper. And then number two, they can tell us about the grading, because we also need to know about the grading. There are some sarcomas that are low grade, there are some that are high grade. And for the high grade one, they are the ones that actually can cause more problem for the patient. And if you don't treat early, can lead to death early. And so you need to know the grading also. And then once you do that, and then you made your diagnosis, you can also stage the patient. Staging the patient is help us to know if the cancer has spread to other parts of the body. Because the treatment you will give the patient also is dependent on that. And so we always advise people to come to the hospital as soon as possible. Because when the cancer cell is still within the area that is supposed to be, as has not gone to other parts of the body, it's easier to treat. And then also we can also achieve cure for that patient. But if they come late, the stage 4, and it has spread to other parts of the body, it becomes more difficult to treat. And that can actually lead to death of the patient.
Yes. So, one of the key issues, and I think we should mention it here and now, is that a lot of patients are afraid of losing their limbs. So, and this is something that stops them from coming into the hospital, because they see this, they are worried. Even they have a fracture, they want to go elsewhere. They say, they go to the hospital will just cut their limbs off. Do you have treatments, any kinds of surgeries and so on that you do that don't necessarily involve them losing their limbs?
Yeah.
What are the options for that?
Thank you very much. And that's the reason why we want them to come as early as possible. Because when you come in stage 1 or stage 2, it's easier to do what you call a limb sparing surgery in which you don't necessarily have to do an amputation for them. You can remove the cancer cell and then send them for chemotherapy or radiotherapy, whichever one that is necessary, and then be able to cure them. But when they come late at a stage when the cancer has already spread to the other part of the body, or it's difficult for you to spare the limb, then you don't have any other option but to do an amputation. But even to say that also, amputation can be done to save life. We have had people that had amputation done for cancer, and they are still living 15 years, 20 years after. And I think we can remove a part of the limb to save the life of the patient, because every life saved is a life gain. So we will not say because we need to do an amputation, then the person has to run away from it. No, the main aim is to cure the patient, and the patient being able to live thereafter. And so, and then even after an amputation, we have so many prosthetics that can be used now. In fact, every day we're having improvements in the artificial limb that is making patients to live their normal life. I'm quite sure we have seen a lot of patients with limb losses that are even running in the Paralympics. They are using artificial limb to run even faster than an average individual will have done. And so we will not run away from treatment that can save their life. We want their life saved. We love them. We don't want issues and things to happen to them, because there's no need for them to die when their lives can be saved.
Oh, thank you so much. I think you said it so passionately. Dr. Alabi, do you have anything you want to add to that in terms of treatment?
Yes, so we just need to keep advocating and let people know, because as he was speaking, I just remembered a patient that came to us about 2 years ago. He ran away because he had a rhabdomyosarcoma, and a man in his early 50s. He had rhabdomyosarcoma of the upper limb, and the tumor was as big as his head. And so when he came because he was bleeding and he was almost going to bleed to death. And it became an emergency because we needed to stop the bleeding. So we used the radiation treatment machine, the linear accelerator, to stop the bleeding. And he didn't need to have any amputation anymore, because by the time we finished with the radiotherapy, the tumor almost just disappeared. This is 2 years after that incident. He's doing fine. He has no recurrence. His tumor is completely gone, and he's been doing fine, and he's been doing his life normally. He still has his limb and he's using it. So we have so many other treatments that are available, but we need to see the patients. The patients need to come early. You know, it's easier for us to save them. It's easier for us to use medical treatment to save them than for them not to present early, and then they come in stages where we practically can do nothing other than offer palliative care. So we have chemotherapy, we have radiation treatment. The NSI Edu Cancer Center has a linear accelerator machine that has the capacity to destroy cancer cells with the machine, and we offer chemotherapy services. Many people also run away from chemotherapy because they've heard so many stories. Oh, it destroys normal cells in the body. It will do this, it will do that. So I tell them, people who tell you that they've not had cancer. And then sometimes they're afraid that, oh, somebody took chemotherapy and died. And then I ask them, did you find out what happened to that person? Probably the person was already in a late stage disease and not necessarily that the chemotherapy kills. So what we benefit on side effects, patients with chemotherapy, radiation treatment, the benefit is usually more. So we encourage people to come out early so that they can have themselves treated on time.
No, I think you're absolutely correct. And I think what you've said is so encouraging. I think that people need to know about this, because, I mean, how often though do you find people have shunned the hospital, gone to alternative methods, and had to come back at the last minute? Is that something you find a lot?
In fact, 7 out of 10 would have gone around Lagos, gone around medical homes, hostile homes, gone to church, gone to the mosque, gone to so many places to seek for help before they eventually show up in the hospital. 7 out of 10. So it's really that high number that we have of people not wanting to first seek medicine. So the outcomes don't usually turn out fantastic, because these cancers would have advanced to a stage where you can barely save the life of such individuals. So hardly does it turn out well on the long run. And that's why we don't have so many survivors from sarcomas, osteosarcomas and likes, because they don't present early to us in the hospital.
That's very, very sad. But if they do present early, Dr. Akinmokun, do you know of any cases of, where they presented early, similar to what Dr. Alabi said, that we've had good outcomes?
Yeah. I know someone that had also sarcoma also when she was younger, and then had an amputation done when she was in year 1 in the university. And I think almost 20 years now down the line, she's still well alive and kicking. And so if the patient presents early, yes, there's possibility of them getting cured.
Wow. So are there any other myths you want to have debunked? Do you want to debunk any other myths or to let people know anything else that they should know about sarcomas and coming into hospital?
Yes. Yeah, well, I want people to get to understand that it's not everyone that comes to the hospital that will cut their limbs off. I mean, it's like I tell people, even when you ask people that have fractures that, oh, why don't you want to go to the hospital? They will say, oh, it's because of that they are going to cut their limb off. And I say, it's not true. Please, people should know that in the hospital, it's only cases that are very bad and beyond that cannot be redeemed again that will get to cut their limb off. A lot of people with fractures, a lot of people with cancers come to the hospital. If they come early enough, they can be cured, they can be well taken care of, and they won't lose their limb. And that's one thing I want everybody to know.
Thank you. Dr. Alabi, do you have anything you want to add to that? Any other things that
so we just want to keep
things are really, we've actually run out of time. So as you're giving your own last tips, if this can be your last words for our listeners.
Okay, thank you. I just want to, years ago, we didn't have the kind of treatments option we have now. In terms of surgical techniques, I've been to the orthopedic clinics and I've seen wonderful surgeries that these doctors are doing, which is actually helping to preserve limb. And we have so many treatment options and not even chemotherapy now that we're using to treat cancer. We have sophisticated radiotherapies, which we didn't have about 10 years ago. So we have advanced in the treatment of so many of these sarcoma treatments so that people are living longer lives and are living without one deformity or the other. So I just want to encourage people affected by any of these cancers and also seek the right help in the right place. Okay, many of our people go to wrong places to get help, and then they come back worse than they would have if they had gone to the right place. So information is very important.
Thank you so much.
Thank you.
Dr. Akinmokun, your last words, please.
Well, I would like to also just re-echo what my colleague has said, that people should seek information and then also seek treatment in appropriate places so that they would reap the benefit of what science can offer them. Thank you.
Thank you very much.
Thank you for watching. Please like, share and subscribe for new video updates.